got a couple of talking points. You guys ready?
Yes.
Okay. So this is kind of a momentous occasion here in Rockland County. The first time that people outside of the hospital systems will be getting their vaccines, and it's the light at the end of the tunnel for us. I mean, we've been suffering through this pandemic for more than 10 months, and there hasn't been an action step for people to take. It's been all defensive. It's wear your mask, watch your distance, wash your hands. This is an offensive move that people can take, and it's just really exciting.
Can you tell us how it's going to work, Janet?
So
Just
today,
explain it, how people, you know.
So today, any healthcare worker in the county or who works in the county, they can live in other counties, can come and get their vaccine. There will be a check-in out in the parking lot, and then we have to check their vitals, make sure that their blood pressure is fine and their temperature is fine. We don't want anyone who is COVID symptomatic to get the vaccine. So they'll start at bays, first in the parking lot, and then once they receive their A-OK from the nurse out there, they'll come back here. We'll get 4 cars at a time. So hopefully we'll be able to run through this, pretty quickly. And then after that, the CDC says that people need to be watched for at least 15 minutes in case of allergic reaction. People who have had allergic reactions in the past will be watched for 30 minutes, and we have a physician and a advanced practice nurse watching them out in the parking lot.
So they will be asked to park outside.
That's right.
Okay.
That's right. Out on the other side of the fence.
Is this going to be a continuing site? How is this going to happen? How many doses are you going to do today?
We have 1,000 doses, unless that changed. I haven't talked to Nita about it. We have 1,000 doses, and that is based upon just what is coming into our community. We are not sitting on doses. We get doses, we get them in arms. We've had to reserve a tiny bit because we're doing Hope Creek tomorrow, but they are definitely earmarked.
And will this be where the site is administered from here? I mean, is this a one-time deal? Talk to me about this site.
This is, I'm going to say most Tuesdays in case there is some sort of unforeseen issue, but Tuesdays from 9 to 1 until we're done. And Illinois has phase 1A and 1B designated. 1A is healthcare workers, 1B, anyone 65 and older, and frontline essential workers. Those are the people that have had no opportunity to work from home during this. They are the ones who had to go into the office, into the manufacturing plant, onto the farm, those types of people. And then the state will determine after that who are in 1C. It is, we have been told that it is other essential workers who are not quite on the front line. So they're not the grocery store clerks, for example. But they have not defined that. And then phase 2 will be everybody else who hasn't had a chance yet.
So what type of outcome are you anticipating today? There's already a super long line down the road.
It is really exciting to see that so many people are here to take their health proactively and to get the shot. We know that this is going to be a little bit clunky. This is the first time that we've ever done this. We had some practice runs. You remember our flu clinic in the fall? That was a dry run for this. However, we did 150 shots that day, and it was an entire day operation. And it wasn't 30 degrees. So this is, it's going to be clunky here and there. And, we've seen it be a little bit clunky throughout the country because there's a piecemeal plan. It is not a federal response. There is a state-by-state plan and then sometimes a county-by-county plan. So basically public health is doing the best it can, and we want people to get the shot as quickly as possible.
Jen, you almost sounded like a sense of relief. On your opening statement. Honestly,
yeah.
Like how do you feel personally that this day is here? And it's been a long 10 months, right? We talked about that,
The same workforce that has been working tirelessly since last January. We heard about the virus from China on December 31st, 2019. That's why it's called COVID-19. My first call with the CDC was January 28th. And we had weekly or several times a week fall every day since. And then in Illinois, it got really bad in the middle of March. So it has been a long, long time. The people behind me, the Rock Island County Health Department staff has been working just nonstop for months. And, you know, we have several more months of this, but we believe that this is the beginning of the end.
Can you talk about how many members of your team are here today?
Well, we're still doing our full operations at the health department. WIC moms can still come and get food for their babies. So I would say that we have probably 25 to 30% of our team here. And it's not going to be the same people all the time. We are going to rotate. Now we are constricted by scope of practice. So a lot of the nurses here will be out here more frequently than maybe some of our clinical staff. Because not everyone is allowed to give shots. You have to be a medical professional. And we have a lot of people who, I am not qualified to give shots. So I don't think you want me to.
Even with all the cars in the parking lot, do you expect to go through all 1,000?
I do. I do.
Now, are you gonna keep going like past 1 o'clock?
That is a possibility. I'm gonna have to let you know if we are gonna be able to do that. It's a long time for someone to be on their feet, and we don't have backup today. So we've talked about it, but I'll send you out an email if we are able to go past.
Is there anything you're looking forward to now that this is, you know, the first of soon to be many mass vaccinations in Rock Island County?
You know, I just think it's just a good reminder that this has been an extremely trying time for everybody in this country. And we're going to get through this with a sense of grace and treating people well. And that includes this phase, which is the beginning of the end, but it is just the beginning. It's going to be months and months before everyone gets their vaccine.